everyone. This is Michelle Fix It. I am going to be doing a video while I'm driving on blood patches. And if you need a blood patch, I'm sorry you're here. So what to expect when you get a blood patch? Well, the first thing is how you get to this point. And so hopefully you were informed enough and you had great enough doctors to let you know that you needed a blood patch to begin with. My situation, I was not aware of blood patches for quite some time. And then I knew that that would be something that I needed for potential resolve of some medical issues that I was having. Because it is strongly suspected that I am not only a spontaneous leaker, but also had leaks from previous epidurals from having children. So, if you need an epidural, if you need a blood patch, the things that I would get ahead of time to make sure that you have your best rate of success with that procedure is I would purchase an abdominal binder. And whether you do that with shorts or you do that as just an abdominal binder, that's up to you. Now that I'm dark, I'm going to sleep. All right. So I'm doing night driving and talking. So I would highly, highly recommend having an abdominal binder for use after you have your epidural blood patch. I would also recommending having different, or I would recommend, not recommending, having varied fluids available for you, because hydration after this procedure is going to be very, very, very important and critical. I would make sure that you are dressed comfortably, that you have availability, you have someone to drive you to and from the procedure, because your best thing that you should do is lay down for a couple hours after your procedure, and then instead of just jumping in the car or truck or SUV, you should be laying down in the back seat on your back, so that way you're giving your body as much laying down time as possible. So I recently found out that even though there are a lot of fancy doctors and fancy hospitals that have put in so much research in this pretty debilitating problem, that they've developed really good protocol on having successful blood patches. However, as for effect, there are a lot of hospitals and doctors that will do blood patches but will not follow the same protocol. And so then you quote unquote blow your patch and you're back at square one again. So making sure that you have a comfortable back seat to be able to lay in, making sure, prepare yourself that you're going to need to remain laying down for 24, 48, or 72 hours. The longer the better, basically. You're going to want to give that blood patch a lot of time to set up, coagulate, and really start forming a clot to patch the leak that you have. And then for the next 6 to 8 weeks, you are going to have to be really, really easy on everything that you do. No BLT. BLT is the acronym for bending, lifting, and twisting. So, no picking up anything over 10 pounds. Some of the communication research information that I saw was, no lifting anything over the weight of a gallon of milk. So if you think it weighs more than a gallon of milk, then you probably shouldn't be doing anything with it, because you can still, create issues for that blood patch. And you don't want to do that because it probably took you a long time to get here. Or, you had a really good doctor, they figured it out really fast, and no harm, no foul, life goes on. But some of us have been leaking consistently for like 18 years before we got to the resolve point. Find out that, hey, we have a leak and it needs to be fixed. So now we're going to move on. Oh, and a heating blanket, like having a heating pad, having ice available, really having a bunch of things to make it where you can temperature control. My back was really, really bothering me, and after the procedure, so I wrapped up some ice packs, gel packs, whatever you want to call them, and I would have those right where the injection site was, so that way I could make everything a lot more comfortable. And then that made me cold, and so I had, things available, heated, pad or whatever for my feet, because if my feet were warm, then the rest of my body felt warm. That's how my body works. The other thing is that you really shouldn't be taking any blood thinners or ibuprofen after your procedure or before your procedure. But Tylenol, acetaminophen, that's fine. So, there you go. So, day of procedure, you will go in. I've read that they do offer at some facilities mild or light sedation or anesthesia. I would have preferred that. That was not given to me as an option. If you have that offered to you, take it, because I feel like I can tolerate a fair amount of pain, but I also feel like people shouldn't needlessly suffer. So if it's offered to you and you don't have any contraindications that would be bad for you, take the sedation. So they'll bring you in there, you'll, hospital gown, all that good stuff. You'll be in the supine position on a CT machine. If you are not going to have a blood patch by CT guidance, that should be a big red flag for you. And you should really consider who you're getting this blood patch from, because they should put you in a CT machine, supine, which is on your tummy, and they'll have you stretched out. You can have both your hands up. You can have, one that is kinked, and then the other one is stretched out. It depends on the anesthesia or the radiologist, neuroradiologist that's doing it. Or whichever physician you have, because there are a lot of different physicians that are capable of doing that procedure. But you want to make sure that it's CT guided. And so they will also give you an IV. I've seen that some people get an IV or a port in their neck instead of in their arm. Mine was in my arm. And that will be where they take the blood from you, and then they're going to mark out, after they put you in and out of the CT machine a couple times, mark out where that injection site needs to be. And then they will take the blood from before they take the blood, they should give you lidocaine injections. And this is why I said that if anesthesia was offered, I would have taken it, because it hurt. It was very uncomfortable, very painful, because my pain threshold was super low, because I had a really bad leak, and it was not ideal at all for me. And so all of those, half of the injections were just very strong, and they hurt, and it was a lot of pain, and it was very uncomfortable when I was already extremely uncomfortable and in pain. So I don't really recommend that without anesthesia. And so once you're all numbed up and cleaned up, and sterile fields and all the rest of that, they'll put towels around you, and they'll make a sterile field, and then they will get some of your blood from your arm in a needle. They'll take it from your IV, and then they'll put it in a needle, and then it depends on the physician and your care plan, but then they will inject your blood into the epidural space that's around your spinal cord. And I was told to anticipate a lot of pressure. My situation did not really necessitate what I would consider pressure, as in, our bodies kind of confuse pressure sometimes with pain, and I'm familiar with that. But when I had the blood patch going in, I didn't experience what I would consider pressure or pain. It was more so in the moments that I had the blood going into the epidural space. I realized that I felt like a deflated balloon that was being inflated. So I felt, from legs, and then it started going up. I felt like I was building, I guess you could say pressure, but I felt like I was basically being filled up anatomically, and so much to a point where, like, when it started in my legs, like my toes fanned out, my legs, I had my legs crossed, they became uncrossed. It was like body pressurized, but not in any type of uncomfortable, painful way. And then it, pushed up through my back and fanned out about the same time between, up my arms and then into my head. And then I felt like I didn't have any more space available. Like I was going to be overinflated at that point. And I was getting to a point where I was scared, but again, not in pain, just it was more of a fear of like, I don't feel like I have any more space for this to go. And I was about to tell the physician to stop, and then she was like, okay, that's it, I'm done. And she was like, so no pressure. And I was like, no, like that, because that wasn't, yes, I guess you could say pressure as far as like, a deflated balloon that felt like they're being inflated, but no association or confusion between pressure and pain for me. I have extensively researched how others felt. Some people have immediate results. The physician that I saw said that it was like a 50-50 thing. So half of the people feel immediately better, and I was in that criteria. And then the other half of the people, it takes a couple days for them to feel like they're improving. And so that hospital's protocol I wasn't a huge fan of, because, again, I've extensively researched this once I found out about it. And I was super late to the game. But their protocol is like, okay, get into the hospital bed and we'll wheel you back to where you go, and then you get dressed and then you go home. And other hospitals, the majority of hospitals that do this as patient care, have the patient lay flat on their back for 2, 3, 4 hours, and then you need to go home in the back seat flat on your back or as reclined as possible, and then you need to maintain laying flat for 24, 48, 72 hours, and then of course the no BLT for 6 to 8 weeks. So I was really, really grumpy that that this was the only facility that was geographically available to me, and they were supposed to be pretty good. They're not the best, and I don't say that to be mean. I say that because the best facilities are supposed to be Duke, Mayo Clinic, and Stanford and Cedars-Sinai. Those are supposed to be the main best places in this country, and they were not geographically available to me at present time. So I had to work with what was available. So just because, and again, still fantastic doctors, but I would, you do what you have to do. But just because your physician is telling you to do something doesn't mean that that's the standard of care. And if you are fortunate enough to be able to research and educate yourself, then you need to take appropriate care to care for yourself, because you are 1 out of 1 for you versus 1 out of hundreds or thousands of patients that this doctor has. And so if you would like to go to the best doctor but you can't, then you read up on or listen to all the lectures that the best doctor or doctors puts out there, and you follow their practices for your medical adventure, journey, whatever you want to call it. You make sure that you match up with what they are doing, and you have to have the doctor that you have, and that's the kind of situation that I felt I was in. So it's one of the reasons I'm making this video, is because I don't want someone to go through the difficult process of getting there, to getting the epidural blood patch, feeling improvement and then not knowing the appropriate protocol or management of that epidural blood patch, blowing it and then having to get another one, or thinking, oh, it didn't work, so I'm stuck this way. Because that's not true. Aftercare is critical and very important when you are going through the motions of these things. So I went over the before, like things that you should get, and then I went over the during. And so the after is kind of going to be parroting back what the before was. So, if you can stay in the hospital for a couple of hours and lay flat, do that. That would be in your best interest. If they're trying to just push you out the door immediately because they're like, oh, our protocol is you're good, then make sure that they wheel you out to your vehicle. Make sure that you lay in the back seat. Pre-prepare maybe for having some blankets back there or something, because some seats, depending on if you have a car or SUV, they have like a little concave end. So before your procedure, go in your vehicle that's going to be the one that takes you to and from the hospital, and lay down in the back seat and think about how comfortable you can be. And so do that, and then so you have them wheel you out. You get into the car. You already know what it's going to feel like laying down in the back seat of the vehicle. If you have ice packs already in the vehicle, great. I did not have them available. I didn't realize that it should have been a good idea until, because I was actively researching why I was laying in bed, because, I didn't have anything else to do. So have your ice packs in there. You can lay down, try to do the shortest commute home. And then lay flat 24, 48, 72 hours. Try to make sure that you have pre-planned to either have somebody assist you with, having foods and stuff available, or just, have snacks pre-prepared, meals pre-prepared so that you can eat laying down, do everything laying down, and really try to limit going to the bathroom as much as you can. Know that it is highly, highly expected that you will end up with rebound intracranial hypertension. So, if you have been actively leaking for a while, or even for just a short amount of time, I think it's your colloidal nexus. I'm not sure if I'm saying that appropriately or not, but your colloidal nexus is very likely overproducing to compensate for the fact that you've been leaking CSF fluid. So colloidal nexus produces the CSF fluid, and of course it's going to try to give you more CSF fluid if it doesn't feel like you have enough, because you're leaking it out faster than you should. So when you patch that leak, it's going to take a little while for your body and for that part of your brain to be like, oh, we're good on pressure. So what's going to happen is, if you pressurize too much with your cerebral spinal fluid, then you could blow the patch because there's too much pressure and there hasn't been enough coagulation. So if you are laying down and all of a sudden, while you're laying down, your head starts to really, really hurt, do not be fearful that, you're still leaking. Intracranial hypertension, one of the symptoms of that is that if you are laying down and then your head starts to hurt. So sit up very, very, very slowly, like do the log roll on your side to get into the upright position. If that makes your head start to hurt a little bit less, that's fantastic. Go ahead and stand up. And hopefully you have your abdominal binder in, so it's keeping everything smushed. And just walk around a little bit. Some physicians will discharge people that they think are going to have intracranial hypertension and rebound hypertension, basically until their body equalizes. They will prescribe medications for in the event that starts to happen. I was not afforded that luxury. So when I did start to have intracranial hypertension occurring, which was very interesting for me because I'm normally intracranial hypotension, but I knew that it was going to happen or could happen. So I sat up. That resolved it a little bit. And then I got to a point where I needed to just stand and walk around. What I found through experimentation for my body, which may or may not work for your body, is I was walking around, and as I started doing like light activities like walking, just things that I could do that were super, super, super low impact, then it was lessening the effects of the intracranial hypertension for me. But then it got to a point where even doing that, it wasn't enough. And so I also have, I have POTS, I have a bunch of different random things. And so I know that heat is not my friend, because heat creates vasodilation, and that makes my blood pressure even lower. Because I also have orthostatic hypotension. So, being upright is not my friend, and then being hot is not my friend. So, I decided to experiment, because you also cannot bathe for a couple days after you have your blood patch. So what I did instead was, once walking was not helping, I put my feet in the tub, and I sat on the side of it, and I filled the tub up with hot water, because I was thinking vasodilation, because if I have too much pressure from cerebrospinal fluid and it's causing pain, then in theory, vasodilation should make it where, things widen up and lessens the pain. And so I put my feet in, and I did pretty hot water, as hot as I could stand. And within a very short amount of time, I coincidentally, causation, correlation, don't know, don't care, it worked, was able to get my headache to subside. And so I kept myself in that position, with the hot water and everything for a while, probably about 10, 15, maybe 20 minutes. And then I very carefully dried my feet off, and I tested the theory of going back in my room and laying down and seeing if my head was no longer screaming at me whenever I was laying down. And it stopped. And so that was fantastic. So I redid that procedure a few times when I was having the intracranial hypertension times, and so that was great for me. So, that's just one of the things that helped me. There are also people that will do dandelion tea. So if you get medication, great. Dandelion tea. You're supposed to stay away from caffeine and salts right after your blood patch, because both of those can cause an increase for cerebrospinal pressure or cerebrospinal fluid pressure. And so I also was, trying to do that. There are certain foods that will contribute to intracranial hypertension. So whatever your coping mechanisms were, if you were a long-term leaker, using caffeine, using salts, things like that, try to lessen those things if you're fortunate enough to get a patch, because those same coping mechanisms are because of being able to produce more CSF fluid, and right now you're trying to retrain your brain and your body to not produce as much CSF pressure on your brain. And then once you get to the point where you are done with your 24, 48, or 72 hours, I was able to do about 72 hours. Continue to use your abdominal binder for 6 to 8 weeks, and be very mindful that you can still blow your patch. And there you go. And hopefully you're not a rinse and repeat, because a lot of people do have to get multiple blood patches in order to completely resolve their issue. And then once they get resolved, because if you are a spontaneous leaker, then you are more likely to end up developing additional leaks. So I know right now that this is not the first and only patch that I will have. As of right now, for my specific situation, because I was leaking, and I was leaking before a CT myelogram. The CT myelogram caused me to leak worse, whether it was from a new leak or if it was making one of my older leaks worse. It doesn't matter to me. All that matters to me is that it reinforced the fact that I'm a leaker, spontaneous leaker, and probably epidural leaker. And so after I was able to get my first blood patch, I immediately felt a lot better, not 100%. Within 48 hours, I was feeling about 70-80% where I was at before the new leak. And being about a week out right now, I feel like I am now 20 to 25% improved past the point that I was at before my CT myelograph. Or myelogram. So as of right now, I am better than I was before I developed a new leak. Not by a lot, but 20 to 25% is huge. I have POTS. I have pretty bad POTS. I have medication for POTS. I have a POTS doctor. I am part of a POTS clinic. I have a lot of comorbid conditions. And I want to emphasize that being a POTS patient, my POTS symptoms have improved 20 to 25% as well as my CSF leak symptoms, because a lot of people that are diagnosed with POTS have POTS as a secondary condition to the primary issue of the CSF leak. So if you are a POTSy out there and you're looking for resolve, this video is for you. And I will continue to try to make random videos on medical stuff that I know about in between making like my normal how-to stuff. But as of right now, I'm still on the very, very low impact lifestyle. So you guys might be getting more talking out of me than how-tos. But you guys like and subscribe. Have a fantastic day. And even though it doesn't seem like it, because I haven't been paying attention to the screen because I've been just talking, even though it doesn't seem like it, I can see through my windshield. The camera makes it seem far more wet and blurred up than it actually is. But like and subscribe. Have a fantastic day. I will see you next time, and good luck with your medical adventure.